Hello, dear friends. Today we are going to talk about a disease such as gout. What is gout? Very often, patients complain of pain in the hands, legs, back. Well, do not rush to immediately diagnose the patient, but let's already understand in detail. The basis of gout is a genetic disease, in which the gene for uric acid utilization is inherited. Gout is considered an aristocratic disease because with gout, people do not deny themselves anything in their diet. As a rule, they abuse alcoholic beverages, wine, beer, vodka, fatty foods, fried, salty, pickled, smoked, peppered, which leads to the rise of uric acid in the blood. So how do you diagnose gout? The gold standard of gout testing is blood chemistry. Here we give blood and look at uric acid. If its indicator is elevated, then we can assume that a person has a disease such as gout. How does gout manifest itself? Gout is divided into two types. This is a lesion of the joints and a kidney lesion. When the joint is affected, the big toe is often affected. Here there is an inflammatory process in the metatarsophalangeal articulation. There is an increase in swelling, sharp pain. Pain, as a rule, is provoked and accompanied at night. By morning, it can subside. Patients note that they cannot step on the leg. Mobility of the joint is limited, and there is a persistent pain syndrome with functional load. But gout can affect not only the extremity of the legs. Also, it can be directly hands, elbows, shoulders, knee joints, hip joints. Where there is osteoarthritis, gout can aggravate this pathology. I also said that gout also affects the kidneys. It affects directly not only the tubules and filtration tubules of the kidneys, but also the cerebral and cortical layer, causing urolithiasis in patients. When the kidneys are affected, pains appear in the lumbar region. They are also provoked at night. The pains can be up to renal colic to acute spasms. When patients use analgesics, none of the drugs can help them. Gout cannot be cured definitively. It can only be led into a persistent remission so that there are no frequent exacerbations. But as a rule, exacerbation occurs 2 times a year, and more often men are sick with this disease because they lead a more abnormal lifestyle, abusing various foods that can lead to a rise in uric acid in the blood. How to diagnose renal gout? To do this, patients take a general urinalysis and see if there are urates and oxalates in the urine. If there is a large amount of them, then here we can suspect these diseases. How to treat gout? When treating gout, it is necessary, first of all, to deal with nutrition. It is necessary to exclude all alcoholic products, especially drinks such as red wine, beer, because these drinks can increase the amount of uric acid in the blood. It is necessary to exclude fatty fried products, food cooked on the fire. Also exclude raw solids and seeds. Let's understand what diet can be observed with gout. You can eat dairy products, boiled potatoes, everything steamed, everything boiled, steamed, dairy products, cottage cheese, sour cream, kefir, grain bread. You can also eat white bread. You can have juices, all fruits and vegetables. If you follow the diet, you can minimize gouty arthritis attacks directly or reduce them to at least once a year. Friends, if you still have questions, ask in the comments below this video. I will do my best to answer them. Subscribe to my channel, click like, click the bell. Have a good day.